Welcome, welcome, welcome in, everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything that we do. We appreciate you being with us today, and we're very pleased to welcome a new presenter to Care Concierge, Latasha Tony, who was one of or has been a frequent visitor to our sessions, who raised her hand and volunteered to present her own unit for us, which happens to be an ethics unit. If you're new to Care Patrol, we are a referral agency. We help people understand their options in healthcare, whether that be Medicare services or paid private services like in-home care sitters. We tour our clients in communities of interest. And if they end up placing in one of those community providers pay our fee so that we remain free to all of the patients, friends, family, clients who you recommend to Care Patrol, and for which we're so grateful for your referrals. Our In order to receive credit, and we're accredited by the Alabama Board of Social Work and the Alabama Board of Nursing to provide 1.0 contact hour for today's unit, which is, again, an ethics unit. In order to receive credit, you must complete our password protected evaluation. And the reason that we use the password protection is in order so that social workers will receive a live or classroom credit hour and not a recorded hour for today's unit. So we do use a password. Listen for the password at the end of today's discussion in order to complete your evaluation. And in the evaluation, we'll ask you, like we asked Ms. Tony, if you'd like to present in the future. And again, we're so grateful to her for stepping up. Our evaluation link, I will read. I know some of you may be on the phone and unable to see the screen. It's so small. Or maybe you're working at your desk and getting other things done while you listen. Let me read for you our evaluation link. That way you'll have it, and we'll read it again at the end and post it then. And hello to Miss Siggers from Mississippi. I didn't know you were from Mississippi, Miss Siggers. It's so nice to have you join us today and often. Our evaluation link, for those of you who are ready to make note of it, is https colon www.surveymonkey.com /r/ all uppercase letters, T as in Tom, F as in Frank, P as in Paul, 2, T as in Tom, B as in boy, 7. And I'm posting the link now into the chat room for you all to make note of it. And without further ado, we'll recognize and introduce Miss Tony, Latasha Tony, who is a school-based counselor and social worker for the past 17 years. And we're so grateful that she came to us again. And I really do appreciate her stepping up and offering us what I expect to be a very interesting and well-received ethics unit in interdisciplinary collaboration and ethical communication. So, Ms. Tony, the floor is yours. And thank you again.
And thank you, Mr. Barnes, for that wonderful introduction. So hello, everyone. As Mr. Barnes has said, my name is Latasha Tony. I'm currently a school-based therapist with a company in Birmingham called Alabama Regional Medical Services, aka ARMS. So we have a contract with the federal government to provide school-based therapy services at 6 different schools in Birmingham. That's Winona High School, Carver High School, Huffman, Green Acres, Hayes, and Brown Elementary. So I'm at Winona High School and Brown Elementary, and I've had this role for about 6 months. I did outpatient therapy prior to this job, and I was telling Mr. Barnes it was boring to me. I wanted to have more of a challenge, so that's why I chose working in a school-based therapy setting. So I worked in inpatient psychiatry for about 8 years prior to having this job. And I don't know about you all, but when I worked in a hospital, I didn't have much training about how to be part of an interdisciplinary team. And I would often get frustrated about things. There were times I wasn't really confident in my role, and I wish I had a training like this to help me when I was in that role. So that is why I chose to discuss this. So we're going to have four main objectives today. One is to just talk about what is interdisciplinary collaboration. What does the code of ethics have to say about working on a team and communicating with other professionals and clients? What biases can come up when we're working on a team with other professionals, and how can we handle those biases? So, what is interprofessional communication? So according to the National Institute of Health, it's the sharing of information by means of verbal, written, or medium among members of different health professionals to influence patient care positively. And also, the World Health Organization identified interprofessional collaboration as a core strategy for addressing the current healthcare worker force crisis and to improve healthcare outcomes. So I like to be interactive when I'm presenting to people. So I want to ask you all a question. So for those of you who have been part of an interprofessional team, an interdisciplinary team, what did you like the most about that experience? So that's my first question. So don't answer the second question yet, just answer the first question. So in the chat, what did you like about being part of a team with other professionals? Anybody?
And I'll interrupt here, Miss Tony. Some folks may be like the camaraderie, hospital social worker here. I love being able to share my knowledge with other professionals. I like other points of view, different perspectives help come up with different solutions, various views, receiving feedback, different viewpoints, having different perspectives. So I was going to tell you all how to use the chat, but obviously, getting a different perspective. I gain others' perspectives, brainstorming.
Okay.
I liked how you
All
can
right.
bounce ideas and now so many responses.
Yeah, thank you. So just being able to have the different ideas, different viewpoints. So what did you all like the least about being part of an interprofessional team?
Being rushed through critical case management,
Okay, I feel that one.
interruptions and talking.
Ooh. Ideas being overlooked, personalities. So yes, all of those things. So thank you all for sharing. So first I'm going to share what our Alabama Code of Ethics has to say about working with other colleagues. So according to Code 3.86, the social worker shall not exploit a dispute between a colleague and employers to obtain a position or otherwise advance their own interests. According to Code 3.A.8, the social worker shall extend to colleagues of other professions the same respect and cooperation that is extended to social work colleagues. So according to our National Code of Ethics, we have an ethical responsibility to our clients. So when it comes to the language that we use in our documentation, it says that we should not use derogatory language in writing, verbal, or electronic communication to or about clients. Social workers should use accurate and respectful language in all communications to and about clients. So whether we're talking to other colleagues or to our clients, we're supposed to be respectful. So as it relates to other professionals, according to our national code 2.01 talks about respect. Code A says social workers should treat colleagues with respect and should represent accurately and fairly the qualifications, views, and obligations of colleagues. B says social workers should avoid unwarranted negative criticism of colleagues in verbal, written, and electronic communication with clients and with other professionals. So we shouldn't be gossiping about our colleagues or about clients. We should make sure that we're being professional and respectful in all communication. Okay, so our code actually has a section for interdisciplinary collaboration. And I wanted to emphasize this one part here. It says social workers who are members of an interdisciplinary team should participate in and contribute to decisions that affect the well-being of clients by drawing on the perspectives, values, and experiences of the social work profession. Professional and ethical obligations of the interdisciplinary team as a whole and of its individual members should be clearly established. So everybody on the team should have a clear role. So when you all think about being part of your former or your current interdisciplinary teams, like what were some professions that were part of that team that you all can identify for us in the chat? Like, of course, we have the social worker, but what were some other professionals represented? Somebody said egos, law enforcement, physical therapy, psychiatrist, chaplain, NP, PAs, guarding that light. And yes, all those different roles. So everybody should have a clear understanding of what their role is on that team. And sometimes you will see that certain roles kind of overlap. Like I know when I was on an IPC team at the hospital, or IDC, whatever you want to call it, we had an occupational therapist, and I learned a lot about what occupational therapists do. And some of what they're concerned about was some of the things I was also concerned about as well. So sometimes it was kind of hard to know, who should be doing what, but it was also encouraging to know that we had the same goal for our clients or patients. And so B says, social workers for whom a team decision raises ethical concerns should attempt to resolve the disagreement through appropriate channels. If the disagreement cannot be resolved, social workers should pursue other avenues to address their concerns consistent with the client's well-being. So there should be a chain of command when it comes to addressing ethical issues, and each company should have that outline. All right, so when it comes to disputes involving colleagues, social workers should not take advantage of a dispute between a colleague and an employer to obtain a position or otherwise advance the social worker's own interests. Social workers should not exploit clients in disputes with colleagues or engage clients in any inappropriate discussion of conflicts between social workers and their colleagues. So like I know in my current role, I started this job back in October 2023. And so I got my caseload from a previous social worker. And so I had clients who often had things to say about the former people. And I would say, that person is not here anymore. We're not going to have this discussion. So it's just important to just make sure that we're setting those boundaries about how we communicate about our colleagues and just about clients in general. So now I just thought it was important to talk about, what the code says about interdisciplinary relationships, interdisciplinary teams. So now I want to just talk about what are biases. So in your own word, what would you say is a bias? How would you define what a bias is? A certain perception or view of someone or something, perceived notions, okay? Oh, preconceived notions, sorry. Beliefs based on experiences, yes. A preconceived notion that may or may not be correct. Preconceived ideas without considering other perspectives. Yes, those are all really good definitions. So, according to the dictionary, a bias is defined as a prejudice in favor of or against one thing, person, or group compared with another, usually in a way that is considered to be unfair. A bias can be implied or explicit, or it could be implicit or explicit. Do you all know how an implicit and explicit bias are different? So basically, an implicit bias is more of an attitude that you have towards somebody. You know, we are in Alabama, so a lot of us grew up like from a religious background, so we might allow that to just determine how we think things should be. So yes, Diane, we just kind of stereotype people based on this idea in our head. So others might not be able to actually see it, but we just have this attitude. And so the explicit is more of an express. It's more of an expression of that attitude or belief about others. So an implied bias might be, you know, this is the first thing that came to mind for me. So we talk a lot about, you know, same-sex marriages. So we might have this idea about, you know, homosexuality, and we might just have this same way we think about that population. But to express that would be, okay, because you're part of this population, you know, you can't work at this company, you know, you can't do these things. But that's how those are different. Or it could be because, you know, I might have this idea towards, you know, Black or even white people that I think about, but I might actually express this and not allow you to work here because, you know, oh, you got this certain kind of hairstyle, so you can't work here for that reason. So those are how those things are different. So sometimes we can just have a belief in our head, and other times we can actually act upon that belief, and it can be harmful to others. So again, we're talking about, you know, working on interdisciplinary teams. So you have the doctor, you have the nurses, you have physical therapists. You know, what are some biases that you have experienced while you were part of an interdisciplinary team? If you want to unmic yourself and talk, feel free. Like raise your hand if you want to actually share. Okay, medical insurance, yes. Social workers are not clinical, just provide resource. Yeah, so that was like one issue I had when I was working in my former role in the emergency room. Oftentimes, if a patient needed a bus pass, they would call me. But there is like so much more to my role than just providing a bus pass or creating a discharge plan for a patient. So we don't know how to diagnose. We just handle DHR. Yes, a lot of people think that we just take people's children for a living, right? Just not understanding what our role is and not being treated as clinical. Yeah, so those are all good examples. So when it comes to professional biases, there are some different ones. These are just some I listed. So you have a scope of practice bias, and that's when a team member might underestimate, you know, our expertise as a social worker or what we're capable of doing. So you might have a doctor who thinks, oh, you know, they don't, because really our role, we're like really experts, right? We really have to research, you know, we use things that are scientifically proven. We've had to go to school for like 4 years to get our BSW, you know, a year or two to be a MSW. So we went through a lot of, you know, studying to get to this point. And so we have a lot of different theories that impact our practice. And so a lot of, and one issue is too, is that in other states, anybody can have the name social worker, but in Alabama, it's different. You know, if you want to be identified as a social worker in Alabama, you have to have a license, and other states don't require that. So, you know, having that license is a really big deal. And I don't think other professionals always, you know, understand that. And then there is a disciplinary centrality bias. So a team member might believe their profession is the most important and their approach should take priority. So you might have the psychiatrist who thinks, you know, medication is the most important thing, and that's more important than what the social worker might recommend as an intervention. And I'm going to actually provide some examples later on of scenarios that might come up. We can kind of see how these biases might be at play. All right, so there's also availability bias. So just overestimating the likelihood of an event based on recent or easily recalled examples. So they have an example here. Therapists might be more likely to recommend a treatment for this one client because it worked well for this one client or patient, but they might not recommend that for this other person because this person might not have the appropriate resources to receive that type of treatment. And there's also anchoring bias. So a lot of times we look at previous information of being in a hospital setting, we have access to older information about that patient when they were there. And we can sometimes use that to determine what might happen, but we really have to treat each encounter with the patient or client as a new encounter. Even if they've used our services before, we still should allow them to present their story in a fresh way, because yes, they might have been admitted for this reason before, but different things might have happened since that admission. So it's just important to always get a good, overview of what's going on with that person and what's bringing them to our individual agency. And there's also confirmation bias. So this involves focusing on information that confirms existing beliefs. So we're looking for information that confirms what we already believe about this person versus just being open-minded to what might be occurring. And so I found this really great website. It's actually, can you all see this? If you can see it.
Yes, it's there.
Okay, yeah, so this is actually the ASHA. It's the American Academy of something. I don't know what it stands for, but I'll put the link in the chat. And I'm also sharing this presentation with Sean, so he'll send it out to you all. But it has a case study here. So it has a team that helps a young stroke survivor return to living alone. So it has a summary of this person. It has like their demographics here, who's a part of their team. It has a speech language pathologist, the occupational therapist, the physical therapist. It has the social worker, the neuro-ophthalmologist, the physiatrist, the patient, and the family. So it has all the medical team, and it has the patient and their support system. And so it has like background information here, and it shows like how the team collaborated. So maybe you're like new to working on a interdisciplinary team in a hospital setting or a different setting, but this would be a great way to kind of see, how each team member can contribute to the patient's overall care. So it has the outcome, their ongoing collaboration plan, and it has like, progress, all that stuff. So I thought it was a pretty cool, site to look at, to just have a case study. So as I promised you all earlier, I have some sample scenarios here. And so I want you all to just put in the chat, give me a moment. So you have a scenario here. So you have this 8-year-old boy, Michael. He has been exhibiting disruptive behaviors in class, which include yelling and throwing objects. Ms. Ramirez, the counselor, referred him for a psychiatric evaluation. During an interdisciplinary team meeting, you present your findings from your home visit with Michael and his family. You highlight the significant stressors Michael faces, including recent financial difficulties and his parents' ongoing marital issues. So you have this doctor, Dr. Thompson. He's the team lead and psychiatrist. He listens while you're sharing your observations. However, when you propose a holistic approach that includes family therapy and potential social services support, Dr. Thompson interrupts. Dr. Thompson says, "That's all well and good, but these behavior issues are clearly stemming from a deeper psychological problem. Medication is the most effective course of action here. We can address the family issues later." So what do you all think is the bias in that situation? If you want to open your mic and share, feel free. And there's no right or wrong answer. We're here all to learn and support each other. So let's see. Solely medical perspective, prescription is the only solution. Yes, because that's one thing about our role as social workers. We look at the person and environment fit, and we look at how all these different systems interact together. So if his parents are having marital issues, that is impacting his behavior. So he has a reason why he's behaving this way. It's not just a psychological thing. I'm assuming there are more issues, no diagnosis, and meds being the only solution. Not taking into account how important all aspects of child life is to behaviors and emotions. Yes, behaviors is medication. At this point, medication may only be a band-aid to what's really going on. There are clearly other stressors that family or play therapy might be beneficial. Yes, I agree, Rachel. All right, so how would you all address this bias if you were part of this team? What would you have to say to Dr. Ramirez? Has anybody experienced a similar scenario before like this? Suggest a holistic approach. Could you open your mic and share more, Ashley, if you don't mind?
If you want to be unmuted, just raise your hand in the app and I'll find you and unmute you.
Yeah, I would like to hear from Ashley and Nicole. Nicole has discussed Maslow's hierarchy of needs. So if either of you all want to maybe open your mic and expound more on that, that would be great.
Which Ashley was it? Was it Ashley?
It was Ashley Stringer.
I'll ask her to unmute. Maybe she will. Actually, if you're familiar with this and you'd like to unmute, we'd love to hear from you.
Okay, I'm here. Hey, I was just saying I would suggest taking a holistic approach and doing concurrent behavior or mental health services along with the medication.
Okay.
To treat the family.
Yeah, I like that idea. Okay. Thank you, Ashley.
You're
and
welcome.
Nicole Erickson, you said discuss Maslow's hierarchy of needs, which I think that's like really important. Because that first thing, it talks about physiological needs. So just having access. She raised her hand. Okay, let's see. How do I?
Who raised their hand?
Nicole, I'm asking her to unmute herself.
Hey.
Okay. Hello.
Hi. Yes, I was just saying, I mean, I think all of us probably in this know Maslow's hierarchy of needs and just kind of educating. I'm sure a doctor has heard of Maslow's hierarchy of needs too, but you got to meet those basic needs before you can get to the higher level needs for sure. And it sounds like some of his basic needs aren't being met. So working from that perspective.
Right, because thank you, Nicole, because being in a hospital or even like an outpatient setting, our first goal is to make sure this person is stabilized and they feel safe. Because if he doesn't feel safe, what is medication going to do? It's like a band-aid. It's not going to address the deep issue there. So Ernest has empowered the MD by asking about working with doctor to report treatments and compliance to MD doing therapy or family enrichment. Yes, I agree. So maybe just exploring other options besides medication right away. So thank you all. So now, I think I'm probably laughing at these graphics, by the way. So you might hear that bell one more time. I apologize. So we have Miss Garcia. She's been in the hospital for 2 weeks on an inpatient psychiatric unit. She's shown significant improvement in her mood and has no recent suicidal thoughts. Mrs. Chen, the therapist, recommends discharge with continued outpatient therapy and a support group referral. You concur highlighting Ms. Garcia's strong social support system from her family and friends. So Dr. Reyes, however, expresses reservations during the team meeting. Dr. Reyes says discharging her seems so risky. Medication is crucial, but therapy can't fix everything. She might need a longer stay to truly address the root of her depression. You explain Ms. Garcia's strong support system and the potential financial burden of a longer stay. Dr. Reyes seems unconvinced. So who here agrees with Dr. Reyes that this patient should be in the hospital longer? And what would justify you saying that the patient should be in the hospital longer? Okay. Does anybody disagree with Dr. Reyes that this patient should not remain in the hospital? Because there's one thing that was important. This patient has no recent suicidal thoughts. So if she doesn't have any suicidal thoughts, then there's not an immediate safety issue. And the goal for inpatient psychiatric is just stabilization. I wonder how patient right to choose impacts this case. I disagree due to her strong family support with the medication. I do not feel she could not see a therapist. So yes, thank you all for what you shared. All right, so in this situation, what would you say is the bias?
I mean, it seems to me that Dr. Reyes is not taking into consideration the experience and attitude of the social worker recommending outpatient.
I agree. Yeah.
Oh,
Does
Jennifer,
the doctor see something in labs? That's a good point, Jennifer, that suggests the patient needs to stay. So that's a really good point. Need more information on this study. And so that would be something that you would discuss if you were part of the IPC team. You know, what did you see that's making you think that this is that big of an issue that this patient needs to stay? I'm not recognizing benefit of IOP. So yeah, so how would you all address these biases that you see in Dr. Reyes in this case? The bias against the effectiveness of therapy and family support. Okay, so let's talk about family support for a moment. So we're talking about biases, right? We're talking about family support. So we don't know all the things of Miss Ramirez's situation, but just think about if you were part of a, inpatient psychiatric team as a social worker in Birmingham, somewhere in Alabama, you have a patient who wants to go home with their family. What might be some things that you might see or this doctor might see about that family that might make them not want to allow this patient to discharge home with their family or their support system? Let's just think about, like, based on our own, professional experience, like what are some things that you've seen that could make a doctor or others on the team leery about the patient discharging home? Weapons in the home. Okay, ability to provide the appropriate level of care. Is there drug use? What about like financial? Financial, yes, poverty. There's some people who come from like lower socioeconomic status, and they're just not able to afford some things. And sometimes we could think what we need is what this patient needs. And the doctor might feel that same way. And so that's where we come in to advocate for that patient and to provide support that's going to help them to be successful. So she has previous history of non-compliance, lack of transportation, rural area for aftercare planning, complete a family conference for aftercare planning. So yes, it's good to have a plan in place. Does the family and patient get along well or argue a lot? So those are all good things that could make the doctor concerned and not want them to discharge home with that support system. And so I like what you all said. So having that family meeting could be a good way to address those biases, and just advocating. So what are some ways to address biases? So these are some steps. Number one, just acknowledge that you have a bias. Sometimes we say, oh, I don't have any biases. I'm fine. I don't misjudge people. But there might be something or a certain area where you might misjudge people. And so it's just being aware of that. It's nothing wrong with identifying that you have when it's like what you do once you identify that you have it, right? So just self-reflection, spend some time, think about what your own biases might be, and just think about how you might have reacted in a situation based off that bias because of, somebody's background or appearance. Also, there are a lot of different tests online that you could do. There's one, it's called the implicit association test that Harvard University they actually have a project implicit bias that you can go to, and it can help you to identify what your personal biases might be. And also another thing you can do is just look at different perspectives. So we all think about things differently. It's okay. It's good to just surround yourself with people who might think differently than you. It just helps you to see things from a different perspective. And it might just help you to have less biases that way. So just, reading articles, reading books by people who have different diverse backgrounds. Also, just challenge your assumptions. When you find yourself making an assumption about someone, just stop and question it. Why am I doing this? Is this because of how I was raised? Is it because of like where, I'm from? Like I know I'm from Birmingham, right? And I went to Huffman. Although I went to Huffman High School, I have peers who went to Huffman. They had different home lives than me. They were like exposed to different things. So I can't think because I go to this one school that everybody there is alike. I'm at Wedona High School now. It's one school, but everybody here has a different background. So we kind of assume because somebody's in the same location as us that they think and see things the same way that we do. I hope that makes sense. And just being open to feedback. So just asking, trusted friends or colleagues, do you notice that I tend to be biased towards people? Like, when do you notice that? And just be open to what they have to say. Just being mindful of your thoughts and how you respond in different situations. You might notice yourself having certain bias. Like I know me, one bias of mine, y'all want to hear it. Who wants to hear it?
I do.
Anybody else wants to hear my bias? Odors. I don't like odors. And one thing I've noticed too, I look at people's shoes a lot. So that sounds like really silly, but we all have those things that we prefer. But like body odors, they really bother me. And so I'm aware of this, and I have to make sure that when I smell certain odors that I don't allow myself to make certain I'm just being honest, but we all have biases, right? It can be a hairstyle. Like I have locks, and people say, oh, she has locks, so she's unprofessional, but it's like a person dresses this way. So we all have, so it's just important to be aware of what those things are, because you can't really tell by what somebody is wearing how intelligent that person is or how much money they have, because you just never know. Not everybody is showy. So, if you notice that you have a bias and you've acted on it, just take responsibility, acknowledge it, apologize, and choose to just do things a different way. I think that's why it's important to have a mentor, people you can actually talk to about these things. although I've been in this field for about 17 years, and I'm like, you know what? It's time for me to find a mentor again. So I can just have somebody to bounce ideas off of, because you want to have a safe space to discuss these things. And being in your work environment might not always be the safe space to address these things, right? So, having people in your life that you can talk to about these different issues. So some different tools to just communicate more effectively with other people. So my job has been encouraging us to just improve our communication when we're like seeing other clients, when we have visitors. There's a thing called AIDED. So AIDED stands for acknowledge, introduce, duration, express, and thank. Example: hello everyone, I'm Latasha Tony. I'll be talking today about this topic. It will last about 45 minutes. These are our objectives. Thank you all for being here. That's AIDED. So just using that in your day-to-day interaction with others, with patients, hello, Mr. Barnes, I'm your nurse, Latasha. This is going to last about 10 minutes. These are things we're going to, include during that 10-minute time. Thank you for trusting me with your care. So that's AIDED. Also, I like dialectical behavior therapy. It's a type of therapy that was started by a lady named Marsha Linenham. She actually had borderline personality disorder, and like none of the therapy at the time could actually treat her condition. So she found this type of therapy called dialectical behavior therapy. And one skill is called interpersonal effectiveness. And so she has different acronym. So you have Dear Man. And so Dear Man, it stands for describe the situation, express your concerns, assert yourself, remember why you're having this discussion. Okay, you all, I forgot. I didn't have it by memory. I'm sorry, but Google Dear Man. It is a great way. I actually have it right here, y'all. I didn't realize this. So I actually have it right here. So it has describe the details, express, assert, reward the person for listening to you, being mindful of why you're having this conversation, appear confident, and negotiate. But if you all Google Dear Man, it will come up, go to Therapist Aid, it's there. And who's heard of I statements before? I'm sure everybody has, right? I statements. I feel this emotion when you, and I would like for you to do this. So that could be something to use when you have people on your team who might minimize your role. It's just communicating in a respectful way how their actions might impact you. So let's see, somebody put AIDED in a chat, and I want to say thank you for that. That was Jennifer. Yes, Jennifer. So Jennifer said, some bias I have seen in the community is about tattoos on the professionals. Yes. A tattoo doesn't mean someone is less competent. Now, I'll admit, even though I have a tattoo on my back myself, I've been biased towards others who have tattoos that are more visible, that are like on their arms, or their neck. And yes, those have been some of the most, professional people. And a lot of those people are often more empathetic and caring than people who have like suits and ties, right? So we can't look at somebody appearance and think this person is less competent or professional because of those things. So there was actually an article in the paper about that a while back I saw. Let's see. So these are just some good books to just help you with being assertive. I think, when it comes to being part of a interdisciplinary team, it can just be good to learn how to be assertive. And there's a book called Your Perfect Right by Robert Alberti and Michael Emmons that talks about assertiveness. My favorite book is by Nidra Glover-Tawwab. She is also a social worker. Her book is called Set Boundaries, Find Peace. And she talks about work interactions in that book. And she has like a workbook too. So that's a great book to check out. And of course, the old and goldie is Boundaries by Henry Cloud and John Townsend. So if you ever have a case that you need like a consultation for, the NASW has a line you can call from 12 to 3 p.m. Eastern Standard Time. And they would answer any questions you have for free about an ethical issue. So if you need to contact me, this is my name, my email address, my phone number. And I have some special treats, you all, for being part of today's presentation. They're just worksheets, by the way. So I have this worksheet here that Sean will send you all to just help you kind of to explore, what it's like being part of a team, what biases you encounter, all those things. And I got some fun coloring sheets too for you all. Just remember that everything you do is important. Don't forget your value as a social worker. All right. So you have what it takes to effectively work on a team. Your contribution to the team efforts matter. So remember that. Okay. So you all will all get copies of these. So thank you all for coming. Here is the survey link again. And the password is Tony, spelled like money, but with a T. And I think Sean might put this in the chat again for you all. But thank you all, everyone who was here.
Thank you, Miss Tony. It was excellent. I learned so much. And one of the things that you brought up was reading books from different perspectives. And I would say that, when I was in college, I started reading books by Black authors, Alice Walker, Zora Neale Hurston, Toni Morrison. And it was interesting that Zora Neale Hurston has a titled work, All God's Children Need Traveling Shoes. And then in I think it was Alice Walker who wrote Beloved. In that
the color purple too. I'm sorry.
Pardon?
She wrote The Color Purple too.
That's right. In Beloved, I learned there was a passage in it about wearing traveling shoes, Zora Neale Hurston's book.
Oh, wow.
And I think that's interesting that you look at shoes because it is part of the Black heritage and cultural position that wearing nice shoes matters. And so it's interesting that you are able to step back and see that bias in yourself. And I have that bias. I look at shoes.
But it's mainly in men that I've noticed recently. I look at their shoes. That's the first thing I notice about them.
That's so interesting. Well, thank you for being here. This was excellent. And I'd love to offer the opportunity for you to present again on any topic. This was an ethics topic, which we appreciate so much. I'll post the link again and the password. The password is Tony, as Ms. Tony said. It's spelled like money with the T, capital TONEY. So that is our password for the day. Remember, you must complete the evaluation in order to receive credit today. Nurses, we will post your hour for you on the ABN website. Everyone who completes an evaluation will receive a certificate, and those will not go out until late tonight or tomorrow morning, just so you know. I leave the evaluation open because I know that some of you need to get back to whatever you were doing and can't quite do the evaluation just yet. So if you need to wait till after work hours, you can, but the certificates will go out once that is present. The password, Ms. Latham, is Tony, spelled like money with a capital T, TONEY. Thank you all for being here today. We appreciate you. Ms. Tony, do you have any? Oh, and on Monday of next week, we'll have another presenter who is a frequent presenter with us, Dr. K. Nicole Brown, who's a social worker, and she will present on parenting the autistic child. So those of you that work in the child care arena, like Ms. Tony, may find that to be an interesting unit that we do next Monday. And the following Monday, we'll have the return of another presenter, Dr. Rebecca Sipma, who's with the UAB Neurological Disorder Movements Clinic, who will be presenting on dementia, another topic on dementia for us. I'll put the survey address back into the chat room, and I'm posting it now. 1 second. There it is. It's https://www.surveymonkey.com/r/all uppercase letters, T as in Tom, F as in Frank, P as in Paul, 2, T as in Tom, B as in boy, 7. And I will, Ms. Frazier, whenever I send out the evaluations, I always include a link for the upcoming week. And you can always go to carepatrol.com and click on your local person, which is typically me, Sean Barnes, and scroll down that page to find a link to register for upcoming presentations. Thank you all for being here. Again, Ms. Tony, did you have anything to add?
Don't just thank you again for the opportunity. And also you all will get a copy of the presentation and those worksheets. So just be on the lookout for that. But thank you all for your time. Have a great rest of your week.
And you as well. Thank you all for being here and have a great week.